nurses have been seeing some really difficult situations in their workplace. Do you think that nurses deserve a pay rise?
Welcome to the Peeps Garden. I'm here with Caitlin Maskell, who caught up with Wes Streeting last week. Caitlin, you spoke to Wes about doctors and nurses and the NHS generally. What did Wes say about giving them a pay rise?
He said, of course, nurses deserve a pay rise, but he said that his plan was going to have to be implemented over a 10-year period. The change and the pay rise wasn't going to come immediately.
I'm pretty appalled, to be honest, that nurses, junior doctors, even consultants have had to go out on strike because of the way that they've been treated by this government. I do not want to see any more industrial action in the NHS. We didn't have national strikes when we were last in government because we treated staff with respect. I know it's going to take time, and I've had to be honest with the junior doctors, for example, saying that 35%, we're not going to be able to do that overnight. But to get back to fair pay, we're committed to that journey. It's not an event, it's going to be a journey, and we'll have to sit down and negotiate with people straight away. One of his solutions that he suggested was that nurses and doctors were going to be given the opportunity to work overtime, on weekends and in evening sessions, which would allow them to get more money, but it would mean they would have to work more shifts because a pay rise won't come immediately. So his solution is work them harder, work more shifts, and that will be your way of getting more money, not the pay rise that they deserve over all these years that they haven't had a pay rise. How are you going to make sure that they're not overworked if they're taking this money? Because we're in a cost of living crisis, everyone needs more money. How are you going to make sure that these people are not being overworked, not letting their mental health suffer? Well, where it is working, we're seeing that done in a responsible way. Staff are really proud of what they're doing, and they're doing it voluntarily, albeit in exchange for fair pay, of course, but they are choosing to do those extra shifts. Where I think we've also got to get to is in terms of things like rotas, contracted hours, making sure that we're showing the flexibility that particularly NHS staff with caring responsibilities need if they're looking after children or maybe elderly relatives. I think that's the kind of flexible and responsible approach we need from the NHS as an employer, and obviously instinctively Labour gets that. We're the party of workers, and in addition to what we're doing in the NHS, we're going to deliver the biggest expansion of employment rights in history. So there's lots to look forward to with the Labour government if people choose change with Labour at the next general election. And what has their response to that been? I can't imagine it would be a very popular solution to what they're asking for. He said that NHS staff are really proud to be, trialling this voluntary programme, but I'm not so sure. I'm not sure that many people will be so sure that nurses and doctors will actually be happy with this, because if they're going to be working more hours when they're already working so many hours, they're just going to be exhausted.